How are you today? So my name is Dr. Smith, and today we will be doing a first-time patient consultation just to get to know you better and to get to know what your needs are and to see if we can nourish those needs and fulfill your goals, okay, through these therapy sessions that you are seeking. So let's get started. Okay, I'm going to create a new patient profile for you. So just give me 1 second as I pull it up, okay? So I need to know from you, okay? This therapy session, I specialize in cognitive behavioral therapy, and I need to know if our services are going to fulfill your needs. So because of that, I need to ask you a couple questions, so do not be alarmed if they are personal questions. So give me 1 second here while I just pull this up. Let me just do let me go to Word and let me just do a new. Okay, so sweetheart, so I need to know, let me just okay, so do you have your ID with you so I could create your profile? Thank you so much, appreciate it. Alexander, what a great name. So Alex, is it okay if I call you Alex? Okay. So what brings you in? Why are you considering taking some therapy sessions? Yes. Well, I'm glad you chose the route of recovery. It's wonderful and it's a great start. And I will just start off by letting you know that, by the way, this consultation is only going to take about 5 minutes, and then we can schedule your therapy session, okay, Alex? So, oh, you prefer Alexandra? I'm so sorry. I did not. I am so sorry. So do you have, what are your medical histories? Any medical history problems that I could annotate? No? Okay, that's good. And you're considering therapy for that reason only, or for something else as well? Yes. So nightmares are actually more common than you might think they are. So seeking therapy might be a great route. Okay. So do you take any medications? And how long have you been prescribed with that medication? 7 years, okay. And have you been in therapy before? And if so, what kind? Really, that's great to know. I actually specialize in cognitive behavioral therapy, so I know that this will definitely benefit you, and it will definitely help you with your anxiety problems that you are facing, okay? Do you have any allergies, okay? And this is just, I'm just getting this information to alert any doctors or nurses in case anything happens for emergency, okay? that's good to know. So I also need to ask you, do you use any drugs? Do you smoke? Do you drink? And how often? Okay, every day, that's fine. Now, is there a reason why? Yeah, very understandable, sweetheart. So, I also need to know, what are you looking for in a therapist? What is your goal throughout these sessions? Great. Well, this is such a great start for you. I am so excited to see your progress and your growth, and just understand that our sessions are 100% confidential, okay? So I've created your profile, and happy belated birthday. Here's your ID back. Okay, so now let's just schedule our appointment, okay? Now, our first appointment is going to cover sleep. You said that you get frequent nightmares and it prevents you from actually sleeping. Sleep is essential. So in our first session, I'm going to get to know you more, and we're going to go over some tips and tricks that you can use, that a lot of my patients have benefited from. Great, sounds good. So let's go ahead and schedule you. What does your schedule look like for next week, sweetheart? And then next week we'll talk about reoccurring appointments, because I need to know if you are going to keep coming. You know, you do your consultation, you do the first appointment, and after that, then you will decide whether or not you want to keep coming in, okay? And then we will establish your insurance information on your new patient profile. But as of right now, we don't take insurance information on the first consultation and the first appointment, because it's kind of just like a test out, okay? So it is free of charge. And just to let you know, insurance information, that's only for specialized, with our company, it's my company. And this, by the way, welcome to New Beginnings LLC. This is my therapy company. So we do provide many different behavioral health and mental services, and we also work with nonprofit organizations to keep youth off the streets. And it's just, we do a lot of beautiful things. We also work with animal shelters, and to provide our patients with service animals, and it's just a beautiful ministry. So as you can see, I have a meerkat behind me. So hun, so what is when can you come in next week? Perfect. So let me write you down on my schedule book. Okay, so let me just check my schedule here. So I have August 9th, or I have August 10th at 1:30 p.m. August 10th, 1:30. Perfect. Okay, Alexander, so I will see you August 10th at 1:30 p.m. I definitely have a good feeling about you taking our therapy sessions. I have a feeling that you will benefit greatly from our services here at New Beginnings. And just know that you might receive a welcome package in the mail in 2 weeks if you do decide to go forward with the services, okay? All right. Again, my name is Dr. Smith, and it was such a pleasure to speak with you today. It was great to know that you are taking this recovery route, and just know that everything is only bound to get better. Okay, so this is what we call a little 90-day guide. This is like a guide, and it's just where you can reflect on accomplishments, areas of development, strengths and opportunities, and purpose and values. And there you go. You can just keep that and reflect on it. Well, it was great seeing you, and I hope that you have a wonderful day.